What needs to happen before it's safe for your kid to get a vaccine? Marcelino Benito breaks it down.
As COVID-19 has surged nationally, more children are getting sick here at home too. Texas Children's Hospital Chief of Critical Care, Dr. Laura Shekademian, sees it up close.
I work in an intensive care unit. There have been almost no days in the last 8 or 9 months that we have not had children with COVID under our care, and they can become very sick.
The latest numbers show 1.6 million children have caught COVID, more than 29,000 kids and teens in our area alone.
We have to launch a new set of clinical trials for kids.
Dr. Peter Hotez says young children haven't been a part of any early trials. Pfizer only recently started including kids as young as 12 in their trials. Hotez says it's critical to get that data before vaccinating children.
If we're going to reach that 60 to 80% coverage across the country in order to halt transmission of the virus, that means eventually we're going to have to vaccinate adolescents and kids.
As researchers turn their focus to children, Hotez says a COVID-19 vaccine developed out of Texas Children's Hospital could be one of the most promising options for children.
We're actually exploring now whether our Texas Children's Baylor vaccine could find entry use into the U.S. as a pediatric vaccine.
Generally, children don't experience severe complications from COVID. Nonetheless, doctors hope vaccinations could start before the start of the fall semester.
Obviously, we can't cut corners because we cannot compromise safety, especially in young children and higher risk children. But I think that would be everyone's hope and dream, and nothing to suggest it's not a possibility for sure.
While children wait, Dr. Shekademian says the best thing parents can do to protect their children is have them wear masks and socially distance. And remember, just because they may not get as sick doesn't mean they can't spread it. Marcelino Benito, KHOU 11 News.